Hi, my name is Jennifer, and I'll be talking about a measles outbreak. The pathogen measles is caused by an agent, which is a virus which resides in nose and throat mucus. Transmission is via airborne particles when an infected person coughs or sneezes. The population that is affected is primarily children, but anyone who is not immune to the disease can become infected. The 2015 global prevalence rate for measles was 36 per 1 million. This graph shows distribution of cases reported by WHO region from 2013 to 2016. You can see that most cases are in the Western Pacific and in Southeast Asia and Africa. In the United States, measles was actually declared eliminated in the year 2000, thanks to widespread vaccination in the United States. So for the outbreak investigation, there was an outbreak in San Diego, California in 2008. Usually when vaccination rates drop, measles is one of the first diseases to reappear. This graph shows percentage of vaccination from 2000 to 2014 in the United States. You can see that after 2007, the percentage of those vaccinated began to fall. So in 2008, there was an outbreak of measles in San Diego, California. The first thing you would do for an outbreak is to make sure you prepare and plan. You would get the appropriate team together, start early, and establish your channels of communication. In 2008, measles was identified in an unvaccinated boy from San Diego who had traveled to Europe with his family. After his case was confirmed, the outbreak investigation was initiated and coordinated with the CDC. Here you can see the case definition for a confirmed case of measles. So next you would identify and count cases and exposed persons. This family actually took the child to his family physician and pediatrician, and where they ruled out a diagnosis of scarlet fever. And then when the boy became worse, the next day they took him to a children's hospital where they drew specimens for antibody testing. Later that day, he returned to the hospital's emergency room due to a high fever and a rash. You would then choose a study design. In this case, a cohort study could be plausible because you're able to identify those who were exposed to the index case. And then you would collect risk information from those people using a questionnaire. You would then tabulate the data in terms of person, place, and time that you collected using the questionnaire. Here's a figure showing the number of epidemiologically linked cases to the index case. 11 additional cases were identified, and you can see the date of onset based on the rash that is characteristic of measles. There were first-generation cases which were exposed to the index case, and also 3 second-generation cases who were exposed to first-generation cases. So the next step would be to perform laboratory analyses using PCR or serologic tests for measles, and then you would conduct an environmental investigation on those areas of exposure, and you would implement appropriate control measures. The recommendations for preventing transmissions from measles importations into the U.S. include reminding healthcare providers to consider diagnoses of measles in ill persons who have traveled overseas, using appropriate infection control practices to prevent transmission in healthcare settings, and to maintain a high vaccination coverage of the MMR vaccine in children, which is the vaccine which includes measles. You would then test and formulate hypotheses for this outbreak. Under vaccination would be the hypothesis of why the outbreak occurred. and then you would plan additional studies to test these hypotheses, including risk analysis of, for example, what reasons parents had not to vaccinate, what the policies are on vaccination for schools in the areas where the outbreak occurred, and perhaps the availability of vaccines could also be a factor. And finally, you would communicate your findings to health agencies and also the community where the outbreak occurred in order to educate the community as well as healthcare providers and overall help improve policies to prevent an outbreak in the future. Thank you.